Hi, my name is Asma. My thesis is about information spotting in sequences and time series, application to gesture and strokes. My advisors are Alicia Fornes and Jose Piados. During this first year, my concern was to perform action or gesture spotting to address the rehabilitation assessment issue within stroke patients. Let's put you in context first. Any middle-aged man or woman in Spain is highly exposed to the risk of getting hit by a stroke. If you survive a stroke, then you will undergo a rehabilitation process in order to recover a part or most of your physical abilities. The issue is that if the rehabilitation process is not optimal and accurate, then the patient may lose a part of his physical abilities forever. That's why it is important to have a continuous evaluation of the patient's physical condition. Actually, the way you are assessing stroke patients, in particular the upper part of the body, dates back to 40 years ago, and the assessment is performed only once in 2 or 3 weeks, so it's not continuous. The idea was to use computer vision to help evaluating those physical abilities, using invasive and non-invasive sensing and in a continuous manner. To do so, we designed an application scenario close to real conditions. The dataset is made public to set in motion this research rehabilitation line. After the signals of the movements are captured by a sensor, which is in our case the Apple Watch, they are being processed entirely or only a part of the action is being processed through the baseline classifier to determine the key movements. This activity recognition chain is a part of a larger assessment pipeline that ends with a kinematic model. This kinematic model analyzes those key movements and determines the progress of the patient. In the coming time, we will move to weekly supervised scenarios to face the lack of annotations in human activity recognition and spot key movements in the wild. The people to whom is dedicated this work indeed have relatively more serious challenges than I did this year. Thank you for listening.